afternoon, panelists. We are the Da Vinci team, grade 12 student researchers from 12 STEM 1. Our study is entitled Da Vinci Codes, Measuring Bulacaños' Willingness to Incorporate the Da Vinci Surgical System into Pandemic Operations. The researchers included in the study are as follows: Almario John Lloyd, Espero Mark Ernest, Ortigoza Alessandria, Raimundo Lauren Blens, and Tres Reyes Andrea Carril. With that, let us formally begin our presentation.
According to CNN Philippines in 2021, some hospitals are unable to accommodate non-COVID patients as per the pandemic, and that non-COVID patients are in fear of getting infected by the virus from hospitals. Following this, due to COVID-19 infection, the number of healthcare workers in the hospitals has depleted, causing a shortage of manpower according to Manila Bulletin in 2021. Furthermore, Lozano, Nelson, and Zemar highlighted in 2020 that as a result of the significant risk to surgeons at the time of COVID-19, several surgical associations have established safety precautions during surgeries. According to Reza et al., as cited by Geary and Sarkar in 2012, robotic procedures result in shorter hospital stays and less blood loss as compared to open surgery. Results from research conducted by Boehm et al. In 2021 showed surgical robots can be performed without risking infection between patients and healthcare workers. Evidently, surgical robots are beneficial for both healthcare workers and patients to lessen the risk of COVID-19 transmission. Thus, this study aims to measure the factors that affect the willingness of the people of Bulacan to incorporate the Da Vinci surgical system, a system of surgical robots, into operations during the pandemic.
But what is the Da Vinci surgical system? According to Rocket 2020, the Da Vinci surgical system is a minimally invasive surgical robot that only requires 2 to 3 small incisions to successfully perform various surgical procedures. Its magnified 3-dimensional high-definition vision system provides the surgeons with an expanded view of the surgical area, allowing them to operate easily. The study will benefit the following. First, we have sponsors of public hospitals, private hospitals, surgeons, patients, and lastly, future researchers. The variables of study include number 1, the incorporation of the Vinci surgical system during the pandemic, and number 2, the factors affecting Bulacaños' willingness to adopt robotic surgery. These factors will be discussed and enumerated further in the statement of the problem.
Statement of the problem. This investigation aims to measure the factors affecting people of Bulacan's willingness to incorporate the Da Vinci surgical system into operations during the pandemic before and after an intervention. Thus, the study aims to answer the following questions. Number 1, how may the Da Vinci surgical system be described based on the following dimensions? 1.1, proficiency, or how the said surgical system helps in preventing COVID-19 transmission. 1.2, reliability, or how safe robotic surgeries are. 1.3, cost, and 1.4, areas of expertise. Number 2, how may the factors that affect Bulacaños' willingness to be operated by the Da Vinci surgical system during the pandemic be described based on the following demographic factors before intervention? 2.1, age, and 2.2, gender. Number 3, how may the factors that affect Bulacaños' willingness to be operated by the Da Vinci surgical system during the pandemic be described based on the following demographic factors after intervention? 3.1, age, and 3.2, gender. Lastly, is there a significant difference between Bulacaños' willingness to incorporate the Da Vinci surgical system in the pandemic based on the following factors before and after intervention? 4.1, perceived value, or how valuable an individual perceives robotic surgery. 4.2, perceived complexity, or how complex an individual perceives robotic surgery. 4.3, wariness of new technologies, or how comfortable and trusting people are of new technologies. And 4.4, fear of COVID-19 infection. In order to answer these questions, the researchers made use of a pre-test and post-test to compare the differences between the answers of the respondents before and after an intervention. Due to this, the following conceptual framework was formed. As you can see, the dependent variable or the factors affecting Bulacaños' willingness to adopt robotic surgery will be measured from the pre-test. Then the independent variable or the incorporation of the Da Vinci surgical system during the pandemic will be utilized as the intervention, followed by measuring the dependent variable once more during the post-test. The data collected for the pre-test and the post-test will be analyzed through a t-test analysis in order to answer the statement of the problem. Following the statement of the problem, the following hypotheses were proposed. HO1 or null hypothesis 1 indicates that there is no significant difference between the perceived value of Bulacaños towards the incorporation of the Da Vinci surgical system before and after the intervention. HA1 or alternative hypothesis 1 indicates that there is a significant difference between the perceived value of Bulacaños towards the incorporation of the Da Vinci surgical system before and after the intervention. HO2 or null hypothesis 2 indicates that there is no significant difference between the perceived complexity of Bulacaños towards the incorporation of the Da Vinci surgical system before and after the intervention. HA2 or the alternative hypothesis 2 indicates that there is a significant difference between the perceived complexity of Bulacaños towards the incorporation of the Da Vinci surgical system before and after the intervention. HO3 or null hypothesis 3 indicates that there is no significant difference between the wariness of new technologies of Bulacaños before and after the intervention. HA3 or alternative hypothesis 3 indicates that there is a significant difference between the wariness of new technologies of Bulacaños towards the incorporation of the Da Vinci surgical system before and after being presented with information. Lastly, HO4 or null hypothesis 4 indicates that there is no significant difference between the Bulacaños fear of COVID-19 in the hospital before and after the intervention. HA4 or alternative hypothesis 4 indicates that there is a significant difference between the Bulacaños fear of COVID-19 in the hospital before and after the intervention.
A quota sampling technique was used in the study due to the difficulty of carrying out random sampling given the restrictions engendered by the pandemic. The respondents of this study are Filipino citizens residing in all 6 districts of Bulacan with a sample size of 56 divided into 4 age groups, namely 11 to 17 or adolescents, 18 to 40 or young adult, 41 to 65 or adult, and over 65 or elderly. The respondents of this study are Filipino citizens residing in all 6 districts of Bulacan with a sample size of 56 divided into 4 age groups consisting of 16 adolescents or 11 to 17-year-olds, 17 young adults or 18 to 40-year-olds, 12 adults or 41 to 65-year-olds, and 11 elderly or those who are older than the age of 65. The table presented shows the frequency and percent distribution of the respondents when they are subdivided into 2 genders, male and female. The results revealed that the majority of the respondents were of the female gender, with a total percentage of 64.29% and a frequency of 36. The male respondents, on the other hand, yielded a total percentage of 35.71% and a frequency of 20.
Methodology. The researchers used both non-experimental and quasi-experimental survey methods of research. Specifically, the one group pretest post-test research design. One group used a pretest post-test as called by query, uses a non-random group of participants to evaluate the outcome of interest after 2 measurements before and after the treatment is administered. For the non-experimental aspect, the researchers conducted an interview with St. Luke doctors Jeffrey Geronimo Pedregosa Domino, MD, with expertise in robotic and minimally invasive surgery through which Dr. Domino's insight on queries related to the study-independent variable were acquired. Instruments. To acquire the data needed, the researchers created a validated instrument utilizing a 4 to 5-point Likert scale, following the outline of the questionnaire utilizing a dissertation conducted by Ananya 2019 in generating a predictive model of patients' willingness to undergo robotic surgery. The questionnaire is divided into 6 parts according to the following factors. Personal information demographic variables. These consist of name, age, income district, and education level, perceived value, perceived complexity, familiarity, awareness of new technologies, and fear of COVID-19 infections.
For the presentation, analysis, and interpretation of data, subproblems 1.1 to 1.4 were answered with the information included in the video-based intervention, as well as the data collected from the interview with Dr. Domino. The other subproblems, however, were from the data collected from the pre-test and post-test surveys distributed to the respondents. Additionally, although the conceptual framework recognizes income and education level as factors affecting a person's willingness to incorporate robotic surgery, the said demographic variables were not included in the factors to be measured due to the immensely unbalanced frequency distributions of the respondents when grouped according to the said demographic variables.
To be discussed are the summary of findings from the data collected and interpreted, answering the subproblem 1.1, which asks, how may the Da Vinci surgical system be described based on its proficiency? Robotic surgeries do not eliminate the contact between healthcare workers and patients during the operations procedure, but they allow a faster recovery time and shorter hospital stay that reduces the risk of COVID-19 exposure in the hospital. The answer to subproblem 1.2, which asks, how may the Da Vinci surgical system be described based on its reliability, is that robotic surgery and the Da Vinci surgical system provides a wide variety of benefits to both the patients and surgeons, such as minimal incisions, fewer complications, faster recovery, minimal pain, and exceptional precision and control. Also, robotic surgery has certain beneficial outcomes compared to open and laparoscopic procedures. The surgical system uses tiny instruments that are far more flexible than human wrists, allowing the surgeon to achieve a level of precision and accuracy that humans cannot accomplish on their own. The Da Vinci surgical system is proven to be safe and reliable as the starting success rate of 80% was even increased to above 95% in hospitals in the Philippines. For sub-problem 1.3, which asks, how may the Da Vinci surgical system be described based on its cost? The cost of robotic surgery depends on the type of the procedure, whether the patient is an inpatient or outpatient, how anesthesia is used, the specific healthcare facility, and what patient health insurance covers. Also, patients who undergo robotic surgery have significantly higher hospital bills, but expenses for the hospital bills depend on the arrangement by the supplier since the continuing expenses are found in the consumable and maintenance supply. Next, sub-problem 1.4 asks, how may the Da Vinci surgical system be described based on its areas of expertise? To answer this question, the Da Vinci surgical system specializes in acute care and general surgery, specialty gastrointestinal, pancreatic and colorectal surgery, gynecologic robotic surgery, female pelvic medicine and reconstructive surgery or urogynecology, adult urology, and pediatric urology. However, the areas of expertise that the Vinci surgical system offers in the Philippines are still limited compared to other countries. For the sub-problem 2.1, the question is, how may the factors that affect Bulacan's willingness to be operated by the Da Vinci surgical system during the pandemic be described based on age before intervention? Here are the answers found for the problem. Ages 11 to 17 or the adolescent age group perceive that robotic surgery is valuable. They achieve a computed value of 4. Ages 18 to 40 or the young adult age group also perceive that robotic surgery is valuable. Likewise, they achieve a computed value of 4. Meanwhile, 41 to 65 or the adult age group do not perceive robotic surgery as valuable nor unvaluable. They achieve a computed value of 3. This is the same result as from ages 66 and above or the elderly age group, wherein they do not perceive robotic surgery valuable or nor valuable. Correspondingly, they achieve a computed value of 3. The adolescence age group, the young adult age group, as well as the adult age group, do not perceive robotic surgery or the Da Vinci surgical system as hard nor easy to understand. They all achieve a computed value of 3. However, ages 65 and above or the elderly age group perceive that robotic surgery or the Da Vinci surgical system is complex, and they achieve a computed value of 4. As displayed in the presentation, all respondents of all ages groups are not familiar with robotic surgery or the Da Vinci surgical system. They achieve a computed value of 2. In terms of awareness, all survey participants of all age groups are comfortable and unafraid with new technologies, achieving a computed value of 4. Ages 11 to 17 or the adolescence age group are afraid of COVID-19 infection in the hospital. They achieve a computed value of 2. Ages 18 to 40 or the young adult age group have a neutral perception towards their fear of the COVID-19 infection in the hospital. They achieve a computed value of 3. Meanwhile, the adult age and the elderly age group have similarly result in the adolescence age group. They are afraid of COVID-19 infection in the hospital and have achieved a computed value of 2.
Proceeding with subproblem 2.2, the question is, how may the factors that affect Bulacan's willingness to be operated by the Da Vinci surgical system during the pandemic be described based on gender before intervention? Here are the answers found for the problem. Male Bulacangas perceived that robotic surgery is valuable. They achieved a computed value of 4. Meanwhile, female Bulacangas perceived robotic surgery as neither valuable nor unvaluable. They achieved a computed value of 3. Next, with a computed value of 3, male Bulacangas perceive robotic surgery or the Da Vinci surgical system as neither hard nor easy to understand. On the other hand, with a computed value of 4, female Bulacangas perceive that robotic surgery or the Da Vinci surgical system is complex. In terms of familiarity, both male and female Bulacangas are not familiar with robotic surgery or the Da Vinci surgical system. Both achieved a computed value of 2. Also, both male and female Bulacangas are comfortable and unafraid with new technologies. Both achieved a computed value of 4. With a computed value of 2, both male and female Bulacangas are afraid of COVID-19 infection in the hospital. For subproblems 3.1, the question is, how may the factors that affect Bulacanga's willingness to be operated by the Da Vinci surgical system during the pandemic be described based on age after intervention? Here are the answers found for the problem. The adolescent age group and the young adult age group did not have a change in perceived value, as both still perceive that robotic surgery is valuable with a computed value of 4. But for both the adult and elderly age groups, there was an increase in computed value. For 41 to 65-year-olds, their pre-test computed value of 3 increased to a post-test computed value of 4, meaning that they perceive robotic surgery as valuable after the intervention. For ages 66 and above, their pre-test computed value of 3 increased to a post-test computed value of 5, meaning that they perceive robotic surgery as immensely valuable after the intervention. Both the adolescent age group and the young adult age group, from having a pretest score of 3, have a decreased computed value after the intervention. A computed value of 2 means that the robotic surgery or the Da Vinci surgical system is not complex in their perception. For the adult age group, their pretest computed value of 3 has retained, even after the intervention, which means that they still perceive robotic surgery or the Da Vinci surgical system as neither hard nor easy to understand. Meanwhile, the pretest computed value of 4 of the elderly age group decreased in the post-test. Scoring a computed value of 2, they do not perceive robotic surgery or the Da Vinci surgical system as complex. As displayed in the presentation, all age groups remain comfortable and unafraid of new technologies even after the intervention. They all scored a computed value of 4. The three age groups 11 to 17, 41 to 65, and over 65 have their pretest computed value of 2 increased in the post-test. Now with a computed value of 3, these age groups have a neutral perception of their fear of COVID-19 infection in the hospital. And for the 18 to 40-year-olds, their computed value of 3 has been retained, meaning that they still have a neutral perception of their fear of COVID-19 infection in the hospital even after the intervention. For sub-problem 3.2, the question is, how may the factors that affect Bulacaños' willingness to be operated by the Da Vinci surgical system during the pandemic be described based on gender after intervention? Here are the answers found for the problem. Male Bulacaños have their pretest computed value of 4 retained. This means that they still perceive that robotic surgery is valuable. Simultaneously, the pretest computed value of 3 of female Bulacaños increased to a computed value of 4 in the post-test. This means that robotic surgery is valuable in their perception after the intervention. In terms of complexity, the pretest computed value of 3 of male Bulacaños decreased after the intervention. They now do not perceive that robotic surgery or the Da Vinci surgical system is complex, having attained a computed value of 2. Females also have a decrease in their computed values. From having a computed value of 4, it decreased to a computed value of 3. This means that female Bulacaños perceive robotic surgery or the Da Vinci surgical system as neither hard nor easy to understand after the intervention. Both male and female Bulacaños remain to be comfortable and unafraid of new technologies after the intervention with a computed value of 4. But, in terms of fear of COVID-19 infection in the hospitals, Bulacaños of both genders have increased computed values after the intervention. Now with a computed value of 3, Bulacaños of both genders have a neutral perception of their fear of COVID-19 infection in the hospital.
Proceeding with the subproblem 4.1, the question is there a significant difference between Bulacaños' willingness to incorporate the Da Vinci surgical system in the pandemic based on perceived value before and after intervention? Here are the answers found for the problem. From its pretest score of 3.54, an increase of 0.67 in the perceived value, post-test average after the intervention indicates that there is an increase in perceived value. The p-value of 0.000 on the perceived value is below the 0.05 margin of error. Thus, the pre-survey and post-survey scores have a significant difference. For subproblem 4.2, the question is there a significant difference between Bulacaños' willingness to incorporate the Da Vinci surgical system in the pandemic based on perceived complexity before and after intervention? Here are the answers found for the problem. From its pretest score of 3.26, a decrease of 0.86 in the perceived complexity, post-test average after the intervention indicates that there is a decrease in perceived complexity. The p-value of 0.755 under perceived complexity is higher than the 0.05 margin of error, indicating that the pre-survey and post-survey scores do not have a significant difference. For subproblem 4.3, the question is there a significant difference between Bulacaños' willingness to incorporate the Vinci surgical system in the pandemic based on awareness of new technologies before and after intervention? Here are the answers found for the problem. From its pretest score of 3.64, an increase of 0.13 in the awareness of new technologies post-test average after the intervention indicates that there is a decrease in awareness. The p-value under awareness of new technologies is 0.065. Given that it is higher than the 0.05 margin of error, the pre-survey and post-survey scores do not have a significant difference. Lastly, for sub-problem 4.4, the question is there a significant difference between Bulacanyo's willingness to incorporate the Da Vinci surgical system in the pandemic based on fear of COVID-19 infection before and after intervention? Here are the answers found for the problem. From its pretest score of 2.48, an increase of 0.22 in the fear of COVID-19 infection post-test average after the intervention indicates that there is a decrease in fear. The p-value of 0.004 under fear of COVID-19 infection is higher than the 0.05 margin of error, indicating that the pre-survey and post-survey scores have a significant difference.
Now that we are done discussing the summary of findings, we will now proceed with discussing the conclusions of our study. Based on its results and findings, the researchers concluded the following. Number 1, robot-assisted surgery does not eliminate the contact between patients and healthcare workers during the operation. Instead, it allows minimal contact for each step of the procedure. Its given benefits such as a faster recovery time and a shorter hospital stay help reduce the risk of COVID-19 exposure and transmission in the hospital. Next, Bulacanos, on average, are not familiar with robotic surgery and the Da Vinci surgical system. The relatively low PTES scores can be explained by the fact that the respondents are not familiar with robotic surgery at the beginning of the study. Next, findings of the study show that the initial perceived value of Bulacanos towards robotic surgery is higher for younger people than older people. With regards to gender, male Bulacanos find robotic surgery more valuable than their female counterpart, who has a neutral perception of the value or benefits of robotic surgery. Bulacanos from younger age groups find robotic surgery and the Da Vinci surgical system easier to comprehend than those of the older age groups before being presented with the video-based intervention. Gender-wise, it is difficult for females to comprehend the prior mentioned system in comparison to males who have a neutral perception. After the intervention, findings show that the elderly and adolescents find robotic surgery to be more valuable than the adults. Based on these results, people over 65, or the age group that is the most likely to experience post-operative complications and health conditions in general, consider robotic surgery more valuable since the video explained its health and surgical benefits. On the other hand, adolescents also found robotic surgery more valuable than the adults. This may lead to the conclusion that as there is a lower variety of vaccines given to minors, and since booster shots are only made available to adults, people between the ages 11 to 17 find it more valuable given its benefits that help reduce the risk of COVID-19 infection. After the intervention, findings show that from having a neutral perception, female Bulacanos find robotic surgery to be valuable. It is attributed to the video-based intervention which showed that the Da Vinci surgical system offers more gynecologic procedures within the scope of its expertise. Next, after the intervention, findings show that the majority of the age groups find robotic surgery easy to comprehend. After being presented with the intervention, Bulacanos' fear of contracting the COVID-19 virus in hospitals lessened in relation to being operated by the Da Vinci surgical system. Overall, Bulacanos are open and comfortable when introducing new technologies. Next, based on the factors that affect Bulacanos' willingness to adopt robotic surgery, findings show that the highest overall willingness before the intervention comes from the youngest age group. In conclusion, younger people are more likely to accept robotic surgery even with low familiarity. Based on the different factors, findings show that after the intervention, the levels of Bulacanos' overall willingness to adopt robotic surgery are as follows: elderly, adolescents, adults, and young adults. People over 65 are most likely to experience post-operative complications and health conditions in general, and a lower variety of vaccines are given to 11 to 17-year-olds. With the video explaining its health and surgical benefits, including the reduction of COVID-19 infection risks, the elderly and adolescents attained the highest willingness. Based on the different factors, findings show that male Bulakeños attained a higher overall willingness to adopt robotic surgery before and after the intervention than their female counterpart. Findings show that there is a significant difference between the perceived value of the respondents before and after the intervention, thus, the null hypothesis 1 or HO1 is rejected. Findings show that although there is a 0.86 decrease in how complex Bulakeños perceive the Da Vinci surgical system, there is no significant difference between the perceived complexity of the respondents before and after the intervention. Thus, the null hypothesis 2, or HO2, is failed to be rejected. Findings show that although there is an increase of 0.13 in how Bulakeños trust new technologies, there is no significant difference between the wariness of the respondents before and after the intervention. Thus, the null hypothesis 3 or HO3 is failed to be rejected. Next, findings show that there is a significant difference between the fear of COVID-19 infection in the hospitals of the respondents before and after the intervention. Thus, the null hypothesis 4 or HO4 is rejected. Finally, the alternative hypotheses that were rejected indicate that there was insufficient evidence for the intervention.
Moving on from the conclusion, we will now proceed with our recommendation. The following are proposed. The Philippine government must commence assessing and planning for the utilization of the Da Vinci surgical system in the field of medicine in order to optimize its application in improving surgical procedures and effectively conducting operations. Due to lack of evidence in the video treatment, initiating an effective seminar and other forms of public dissemination of information would greatly encourage individuals' willingness to incorporate the Da Vinci surgical system, providing significant information that would allow individuals to broaden their own knowledge of the surgical system and robotic surgery in general. Use a larger sample size when using random sampling in order to approximate the population as closely as possible. A larger sample size provides more accurate means values, thus increasing the survey's reliability. Begin an interview with patients who have already undergone procedures in the Da Vinci surgical system area of expertise, as this would provide more accuracy and precise information that would benefit the primary study. Initialize conducting an interview with surgeons who are already specializing in implementing the Da Vinci surgical system in several medical facilities, as this would testify to its effectiveness in terms of medical and surgical operations, increasing its credibility. Respondents must be assessed for their familiarity with the robotics and its application to medicine at the outset of the survey.
That concludes our presentation of our study entitled Da Vinci Codes, Measuring Bulakeños' Willingness to Incorporate the Da Vinci Surgical System into Pandemic Operations. Once again, we are the Da Vinci team. Thank you for listening and God bless.